In this podcast episode, the host speaks with Dr. Joel Gator Warsh, a board-certified pediatrician with a functional medicine orientation. The conversation delves into the complexities surrounding childhood vaccinations, the rising rates of chronic diseases among children, and the importance of informed consent for parents. The podcast opens with a candid acknowledgement of the contentious nature of vaccine discussions, particularly in the wake of the COVID-19 pandemic. Dr. Warsh emphasizes the need for a balanced perspective, arguing that parents deserve to understand both the benefits and risks associated with vaccinations. He notes that the current climate often forces parents into polarized positions, either pro-vaccine or anti-vaccine, without room for nuanced discussion. Dr. Warsh highlights the alarming rise in autism rates and childhood cancers, suggesting that these trends warrant a closer examination of the factors contributing to children's health. He stresses that an educated parent is a responsible parent, and that discussions about vaccines should be open and informed rather than dogmatic. Dr. Warsh points out that vaccines should meet a high bar of evidence before being administered to newborns, especially when the risks are low. He discusses the hepatitis B vaccine, which is often given shortly after birth, and questions the necessity of this timing given the low risk of transmission in infants. He argues that while vaccines have undergone safety testing, the long-term effects remain largely unstudied, particularly concerning the aluminum adjuvants used to enhance immune response. The conversation shifts to the importance of understanding the cumulative effects of multiple vaccines administered simultaneously. Dr. Warsh expresses concern that the current vaccination schedule may overwhelm a child's developing immune system, particularly when vaccines are grouped together. He advocates for more research into the safety and efficacy of these combinations, emphasizing that parents should have the right to make informed choices based on comprehensive data. The discussion also touches on the use of aluminum in vaccines, which is intended to stimulate a stronger immune response. Dr. Warsh acknowledges that while mainstream research claims aluminum is safe, there is a growing body of evidence suggesting that it may contribute to chronic health issues. He urges for more independent studies to assess the long-term effects of aluminum exposure through vaccinations. The introduction of mRNA vaccines, particularly during the COVID-19 pandemic, raises additional questions. Dr. Warsh explains that while mRNA technology has the potential to revolutionize vaccine development, concerns remain about the long-term effects of synthetic mRNA in the body. He notes that the initial understanding of mRNA degradation may not align with emerging research, which indicates that these synthetic messages can persist longer than expected. As the conversation progresses, Dr. Warsh emphasizes the need for a holistic approach to children's health that extends beyond vaccinations. He advocates for a focus on nutrition, physical activity, and mental well-being. He encourages parents to prioritize whole organic foods and to be mindful of the toxins present in processed foods. Dr. Warsh highlights the importance of reducing screen time and promoting outdoor play, as excessive screen exposure can hinder children's social development and overall health. He suggests that parents should create environments that foster exploration and creativity, allowing children to learn through play rather than rigid educational structures. A significant theme throughout the podcast is the concept of informed consent. Dr. Warsh argues that parents should be empowered to make decisions regarding their children's health without fear of judgment or coercion. He believes that open dialogue between parents and healthcare providers is essential for fostering trust and ensuring that families feel supported in their choices. Dr. Warsh's approach to functional medicine emphasizes the importance of understanding the root causes of health issues rather than merely treating symptoms. He encourages parents to take an active role in their children's health by educating themselves and seeking out reliable information. In closing, Dr. Warsh expresses his frustration with the current state of pediatric healthcare, where discussions about vaccines and children's health are often met with resistance. He calls for a shift in the medical community towards a more open and collaborative approach, where parents and healthcare providers work together to prioritize the well-being of children.